My name is Ian Grant. I'm a behavioral neurologist here at Northwestern at the Meslin Center for Cognitive Neurology and Alzheimer's Disease. Aducanumab is a medication that is an antibody directed against one of the proteins associated with Alzheimer's disease called amyloid. This medication targets the amyloid so that the body's own immune system can remove it. Similar medications have been tested in the past, and they've mostly been found to be fairly effective at removing these proteins. However, there's not been a clear benefit in terms of patient outcomes. With this particular drug, there were some suggestions that maybe certain individuals did have a benefit in terms of slowing the progression of the disease. The approval of the drug and the drug itself are controversial for a few reasons. The big reason is that typically these sorts of drugs have to pass a full phase 3 clinical trial in order to show their efficacy. The drug was approved based on analysis of some data that came out of two separate but parallel studies. One of the studies was found to potentially have this benefit. The other study was not found to have the benefit. This was controversial because neither study was actually carried out to its pre-planned endpoint. They were stopped in the middle as part of something called a futility analysis because it looked like there was not going to be a benefit from the drug. When the company went back and reviewed all of the data, they did find this potential benefit in certain individuals at the very mildest stages of the disease. Originally, when the FDA approved this drug, there was even more controversy because the label that came out associated with the drug said that it was for the treatment of Alzheimer's disease, which is an extremely general indication. And so after some discussion, this was narrowed to include people with Alzheimer's disease, but people who are at the very mildest stages. So essentially people who are still generally independent in terms of their ability to go about their daily lives, but do have evidence of the disease as proven by the presence of the amyloid protein. The other things that are somewhat controversial about this drug, one is the cost. So the drug is being marketed as costing about $56,000 per year. This would be a very, very large out-of-pocket expense in individuals who can't have any of this covered by insurance. And this piece is actually something that's still under consideration. The Centers for Medicare and Medicaid have announced that they'll issue some guidance probably around the turn of the new year to say if and how much they might be covering this drug. The other insurers around the country have essentially said that they will wait to issue their own decisions until they have some guidance from Medicare. The drug is administered through an IV as a once-a-month infusion. As far as side effects go, about 20 to 40% of people in the studies did have some changes in their brain that could be picked up on MRI. This involved either some swelling in the brain or some areas of bleeding called microhemorrhages. So in the past, Alzheimer's disease was often diagnosed just based on clinical features and the symptoms that they have, but there are markers that can detect the abnormal proteins, the amyloid in particular in the brain, either via scans or lumbar puncture, spinal tap analysis. So it would be a requirement to know that a person has the amyloid in their brains based on one of these tests before they would consider to be eligible at all. Right now, we're staying relatively ambivalent about the drug in the fact that the benefits are not 100% clear and there are some real risks and costs that should be considered, and so it really needs to be a decision that's made between the physician and the patient. I think that it's worth considering that some of the things that may have come into play are the facts that there's not been an approved medication for Alzheimer's disease since 2003, and patients and families are understandably very desperate for anything that might help them.